What's going on, everyone? Happy Friday to everyone. Hopefully, everyone is doing well, staying safe, healthy. If you had to take a COVID test, hopefully you have tested negative. It is time now for the Friday edition of the Pandemic Update for Friday, October 6th, 2023. Wasn't planning on doing a pandemic update today, but this evening I was taking a look at some wastewater data and I saw some things catching my eye that I really want to share with you because we are technically going into a holiday weekend. Some people do have off on Monday, and this weekend historically is a big weekend up in the Northeast, up in New England for leaf peepers. And I want to share with you some numbers going into that weekend that are not good. So first off, I do have one or two news items to share with you. And first off, that is a combined COVID-19 and flu vaccine is getting closer to reality. And this is Moderna. Moderna is making significant progress on a combined vaccine for both COVID and influenza. It's going to go into the final stages of trial, and we'll see what happens. Maybe perhaps next year in the fall, maybe this will perhaps be a thing where you can get one shot for the flu, and it's also good for COVID. We'll have to see how that goes. Then moving on to this. This is some of the other things that I found today that are not good as well. Weekly hospital admissions in England. Look at this chart. You can see it here on this chart. It's really starting to go up. It's an increase by 24.8%. It's up by 759. In the last 7 days, there's been 3,819 patients admitted to the hospital for COVID in England. That's not good. Back in the early days of the pandemic, we used to follow England pretty closely. Then there would be new variants that popped up in the United States that originated here, new variants there. It just got all jumbled, and we don't always follow to a T what's going on there right now. However, if you do take a look here, you can see they did have a rise around the same time as we did from July up until September. Then it dropped a little bit. Now it's rising again. Some are saying the United States right now it's not expected to rise again for a while. I think that's going to really vary in different places. We'll have to see. But again, England, a concerning rising trend right now. Hopefully that slows soon. If not, that's really a concerning level, a level they have not seen in a while. All right, moving up north of the border, back in North America, but to Canada, Ontario, Canada. And take a look at this. Test positivity is now at 17.4% for the week ending September 30th, up from 16.8% last week. Yes, this is some slightly older data, but hey, this was posted today, and you can see here from summer on, wow, the positivity, it's just really going up. It's just not good up in Canada. Speaking of tests, I asked a question on Twitter this afternoon. If you're using a rapid test, the poll question I put was, list what rapid COVID test you have found to be the most accurate for you. And I said I may use some answers in the next pandemic update. And the first response here that you see on top here from Bree says Flowflex was fast positive for me within 36 hours for a reinfection. I think I also trust Bionex. A lot of people said Bionex. iHealth pops up. Flowflex pops up. HotGen. I can't say I've heard of that one. And then there's a Bionex, and someone said FastTep. So yes, Bionex clearly here is the most popular one. If you follow me on Twitter, add your response down below. I'm curious to know which one you have been using. Here, I've been using the iHealth ones as of lately, and they have seemed to be pretty reliable, at least for what's been going on. Here, as you know, my dad had COVID a few weeks back, and it was pretty accurate for his case. So yes. Now moving on to this, we have to take a look at air quality. This is relatively important. This is something I like to look at each time we do a pandemic update at home, and thankfully we're starting to come closer to the winter months. We're into fall now, and the winter months, air quality tends to get better unless there's a fire or something. Still some relatively Um, low, low to moderate levels in the east. Right now, it's the humidity is way up in the east right now. Dew point here actually hit 69 today, which that's way high. So anytime the humidity goes up, air quality tends to be a little bit more poor. But you can see behind that cold front, look at the air qualities here in the Midwest, the Great Lakes. Very good. However, we do have some concerning levels in portions of the West Coast. California, coming up here into Oregon, Washington, just a few concerning levels with the biggest concentration being in California. Can we look at air qualities in Hawaii? No, we cannot. But you get the idea of what is going on here. The majority of the country is fine. Just some yellows in the east, which I'm not terribly concerned about. That should clear over the weekend. Next time you see me do a pandemic update this weekend, I suspect that's going to be better. Let's take a look at heat-related illnesses. Again, that's not bad either. We can see there are some heat-related illnesses still in the southeast. I think that's slowly going to go down because we're starting to come out of the heat season. There's a pattern change coming. We will get an update out on our climate channel. We have not done one in a while. I promise to get one out this weekend. That is my goal. If I can get one out this weekend, that would be fantastic. Walgreens did update this week. And you can see the positivity at Walgreens is 27%. It dropped by 1% from last week's 28%. That's because testing went up. And cases, they are slightly coming down right now. 11,284 tests last week, or in this week's update, and the last update there were 10,209 tests. All right, BioBot. You can see here on BioBot, the Northeast is continuing to rise. It had leveled off, but now it's rising again. Some other regions have leveled off. I don't think the other regions are going to see a quick rise, maybe more just of a leveling, maybe even a slight dropping. The Northeast is a wild card region. It used to be called Columbus Day Weekend. What's it called now? Indigenous People Weekend? Something like that? There's a new name for this holiday weekend. Put it down below if you know the correct term. Apologies, but used to be known as Columbus Day Weekend. Any event, this weekend being the first weekend in October, historically is a big leaf peeping weekend in New England, which brings large numbers of people to see the fall foliage on the trees. And that generates some large congregations of people in some tourist towns. And I thought we would take a look at a few wastewater sites. Here's the CDC update, by the way. First off, let's move myself to the left. CDC shows 80 to 100% COVID detected. There's 130 sites at that. 60 to 79%, there's 282 sites. 40 to 59%, 363 sites. 20 to 39% COVID detected, 175 sites. 0 to 19%, 43 sites. And new sites are 76. But you're also seeing a lot of states such as Ohio, New York City. That's not a state, but New York City, the city itself, it's coming up gray. Louisiana, almost all of Louisiana is not reporting. And is there any sites at all in Ohio? I'm seeing just one site that has reported in Ohio. Don't know what the deal is with that, with the lack of data. Now let's go over to the wastewater scan site. They've made some changes to this site. Anything in orange is high COVID detected. Then you have this goldish color, which is medium. Then you have blue, which is low. You're seeing in the northern states a lot of high levels of COVID being detected. Let's start off here with Montpelier, Vermont. This one really catches my eye. Take a look here. We're going to look at the chart. Here it comes. It's coming. We're actually going to click on the full chart. Here's Montpelier, Vermont. It started rising a little bit back in July, then it dropped a little bit, and then from about September 18th on, this site started rising to the 25th, and then from the 25th on, kaboom, straight up. Look at this, like a rocket ship. It is going straight up. COVID levels are exploding in this area. This is not good. We can actually look at this heat map, and you can see the color. It's starting to become more prevalent, and what that color represents is higher levels of COVID. So this is not good, and it's continuing to get higher. Let's go back to the map, shall we? Let's take a look at some more areas in New England. We can take a look here at the great state of Maine. Let's take a look at Lewiston, Maine. It's also showing up for high levels of COVID. It was rising. Now it is starting to drop a little bit. So that's not as concerning. Montpelier being one of the most concerning right now. Let's go over to the Pencock wastewater facility site, and you can see here on this site, yes, it is clearly, it's bouncing around, but the overall trajectory here is it's continuing to rise. New Hampshire is going to see an influx of people as well for this weekend, especially around the area. Can we go anywhere near Mount Washington? Unfortunately, we cannot. We might be able to on the CDC website. Let's go back to Vermont for a second. Let's take a look at Burlington. Wow, look at Burlington for influenza. That is really starting to go up. You can see it is dropping a little bit for COVID. There's another site in this area, which is Essex Junction, Vermont. We do want to take a look at that. We can see, wow, look at Essex Junction. Let's zoom this in. Wow, literally, again, much like Montpelier, it is rapidly rising, literally going straight up. So this is not good to see either. And let's come down here. Let's come down here to Pennsylvania real quickly. Now, this is not an area that's going to see an influx of people this weekend. Let's go to Harrisburg. You may recall we looked at Harrisburg last week on Twitter. Did we do it on video? I think we did. There was, back on September 21st, an Mpox case was detected. Taking a look at COVID, it's finally starting to drop there. That's some good news. And we're just going to do a couple more sites. I just gave a whole bunch of attention to the Northeast. Let's go down south real quickly. Let's take a look at Atlanta. What is going on in Atlanta, Georgia? I want to know. So according to this, let's zoom in. Atlanta, Georgia, it's starting to rise again. From about September 21st on, Atlanta, Georgia COVID levels are rising again. This is now South Atlanta. This is not, there's several wastewater sites in Atlanta, and some of them show different things, but it's interesting to take a look at this. Let's go back to the map for a second, but before we do that, was there any Mpox detected here? No data showing up for Mpox there. So that's interesting to see. And to be fair, let's go out and do a site in California. Let's take a look at Los Angeles. How about we'll do the northwest portion of Los Angeles. Let's see what's going on there. Look at that. COVID, it's medium, but it's starting to rise again. You can see RSV is on the rise, no flu, and oh my, there was that, back on September 12th, there was that detection of an Mpox case. Alrighty, moving on. EG.5 is the leading variant at 29.4%. We're also watching HV.1 at 12.9% and FL 1.51 at 13.7%. Hospitalizations this week, they're down. 18,139 people in the hospital. Speaking of dropping hospitalizations, let's take a look at New Jersey. New Jersey did have a drop in hospitalizations today. After going up yesterday, they dropped to 622. Yesterday was 684. That, I think, is a decent update, and 70 out of 70 hospitals reported. So that is good to see. We do want to take a look at the Philadelphia Fire Department. I should have had this up on the screen. Did not. You can see in Philadelphia, 791 EMS incidents reported yesterday. That's close to 800. It's still high. I've been hearing ambulances left and right, and I've been seeing ambulances left and right in suburbs. You can see Montgomery County is a little busy right now, but these EMS special service calls, that's likely a product of it's Friday night football, a place that has been busy all day long. Chester County has just been seeing a tremendous number of calls. About a couple hours ago, it was up to 20 calls. It's still between 12 to 15 right now. So this is not good to see. Now let's go up to New York State. And you can see in New York State, COVID cases, there were 2,927 today. Coming over here to hospitalizations, you can see it did rise. It ended the week on a rise. That's never a good thing to end the week on a rise. You can see in New York State, 1,694 people in the hospital, 173 people in the ICU, and 166 people yesterday in the ICU. So ICUs also went up today. Let's take a look at newly reported hospital admissions. Hospital admissions today in New York State did also rise from yesterday. There were 266 yesterday, 312 today. That's not good to see a rapid, once again, starting to go up. And we saw this happen not so much the end of last week, but the week before it happened as well. Did it happen with hospitalizations? I want to know. Did New York State end? No, they did not end the week up last week, but the week before they did. So they may continue the upward trend when they start the new week next week. And remember, we won't get the fifth day of data again until Monday for New York. Moving on, we do have an update on the positivity from California. This is good. California's positivity overall week over week is down. Looks like they were ending the week, but when you look at the bars here, looks like it was starting to go back up again, but for the most part, it is slowly trending downward. It may start to level out here at this 8% level. Deaths, they are dropping, then they ended the week up a little bit. See, remember, they do weekly updates here, and you can see here, it looks like this week was up a little bit. And this is as of September 11th. Let's refresh this. No, that is the most recent update. So the deaths, that is really behind. Hospital admissions, September 30th, a little bit better, but remember, we're at October 6th now. The daily average is 314. It doesn't give a current total of how many people in the hospital. It just shows how many were in the hospital since the pandemic started, which is 606,000. And California does have a pandemic death total of 104,049. So, yeah, that's a bad number. Not a number that California should be proud of. LA. Taking a look at LA, the current 7-day average is 303 cases. That's through the 30th. I do want to update this. No, that is the most updated number. Okay, so we don't have any October numbers yet from California, even though it says last updated on the 5th. Taking a look here at testing through September 30th, you can see here, testing, it's dropped a little bit. That's not good to see. But what is good to see is the positivity rate is dropping. It's down to, looks like it's just at or below 8% level now. So that's not terribly concerning. But again, it is 8%. That's still a little too high. Taking a look at some international data, specifically Europe today. Cases in Russia are up 14%. The death rates, they're up 25%. Romania, deaths are up 15%. Cases are down 11%. Then coming down here to Poland, cases now up 7% again. Deaths are down 33%. Belgium, cases up 3%. No deaths reported there. And then we come here. Let me move myself to the right to make this easier to see. We come down here to Slovakia, where cases are up 17%. No deaths reported. Italy, cases, they did not report them this week. And they also did not report on their deaths this week. Neither did any of these other places. So that's a bit of an international update. Again, keep in mind, folks, this is a 3-day weekend in the United States, not around the world. So if you have off this weekend, maybe you're going away for the 3-day weekend. Remember, this is key, very important. Mask up wherever you go. Leaf peeping season, it's going to continue in the rest of the country, in the northern states, and it's eventually going to make its way to the south. So this is something that we're going to watch. It draws large crowds of people bunched together. And that, my friends, will cause COVID to surge. This is one wave that is probably the most underrated wave of the year. A lot of people just don't think about it. Think, oh no, it's going to drop now and we're going to see a rise again around the holidays. No. In the northern states, this is a huge deal. It will cause COVID cases. Remember, we're in variant soup right now. So with all these different variants, I don't care what this model or that model shows, you're going to see these real small, tiny towns just quadruple in size this weekend with people. And it's going to get jam-packed. I could probably show you Google Maps right now, traffic, and it would just be bumper to bumper up in New England. And we will take a look at that. We're going to do a pandemic update, I think, again tomorrow on this same issue, and we're going to take a look at that. We're going to do it right at the peak time when there is just bumper to bumper traffic in New England. I'm going to show you what I'm talking about with these, large crowds of people that are going to be gathered together. Let me know. I want to know, is this a big deal in the West Coast? How about the Northern Plains? How about the Great Lakes? Do people gather for fall activities on this weekend out in the West? Let me know if they do. I want to know, because guess what? We can start looking at wastewater sites out there to see if this will cause a surge for you as well. Alrighty, folks, that does it for today's pandemic update. We'll have another one again tomorrow. Oh, look at that. I said it would be a short update. We went 20 minutes. If you like this video, give it a thumbs up. If you want to see more content like this, hit that subscribe button down below. And by all means, share this with anyone that needs to see this video, especially those up in New England. Please share this with your friends. Let them know that, hey, your town right now could be seeing a massive surge of COVID with the influx of people. Alrighty, I'll see you all again next time. Until I see you again next time, stay safe, everyone. Have a fantastic weekend. See you again tomorrow.